And then while that's getting started, I'll work on sharing my screen. Okay. So you should be able to see my screen now and my PowerPoint. If not, give a holler. We do have a lot to cover today, and I'm sure there'll be a lot of questions. So I will go quickly, but hopefully not too quickly. As usual, just a reminder, this call is for school personnel and health department staff. The talk today is being recorded, and the slides and the recording will be posted on our public facing website. So it will be publicly available. We just ask that only staff be on the call for the sake of time for question and answer, and make sure any needed information get passed on to any of your staff that may need it. First thing, I just wanted to share that we were notified that a blueprint for comprehensive student recovery was announced yesterday. Likely you all heard about this as well, but just in case, I just wanted to let you know about it. It gives guidance to help schools to create recovery plans. So basically looking forward to the next school year, ideas and tips and lots of resources to help students in multiple different facets to start to recover from this last year and a half. This morning I sent out to hopefully everybody or all the schools, either your administrative assistants or superintendents or whoever your point of contact is, some guidance that we put together to try to give you some new criteria to waive quarantine in certain situations, knowing that in certain situations, the risk for disease transmission is lower. It's not always zero, but it's lower. And quarantine, as we know, can be a burden on your students and their families. So you should have gotten that in your email. We will resend it and post it and things. If for some reason you didn't get it, again, see if someone in your organization did get it, or make sure you update your contact information with us. But the gist of it is that the definition of a close contact stays the same. And that's just because people that are exposed need to know that they're exposed. You know, that definition of a close contact is really based on how diseases like COVID spread. And that doesn't change, but looking at then the ability to waive which ones of those close contacts have to stay out of school. And I'll get to that in a second. But in order to do that, the students that are in the classroom, need to be following the recommended mitigation measures, particularly proper masking for both the person who has COVID and the individual who was exposed. And then on a bus setting, they also need to be following appropriate mitigation measures. One thing I did not put in these slides, but it is in the the PDF that you were sent or that we'll be sending you. This does not take into consideration people that have been fully vaccinated or that have had COVID in the last 3 months. Those people are excluded from quarantine. So this is only addressing those individuals who are not exempt from quarantine. So I just wanted to make that clear. So if you choose to use this option to waive full quarantine in certain individuals, it is important that you make sure that your school community and families know that, because there is some risk involved with it. It's very small, but there is some real risk involved that you could be, causing a small increased risk of COVID infection in the schools. So it's just good to have transparency. You're not required to do this. It's an option that we're giving you. And you can also stop it at some later point. We know it's late in the year right now, but if this is something that works and it continues, Should there be a large outbreak or something, it's something that can be stopped or paused. And we're always happy to work in consultation with you to decide what's best for your individual school. So the criteria to waive a traditional quarantine for a student would be if you have a K through 12 student that meets the definition of a close contact, and it says as described above, because I literally copied and pasted this from the full guide. So it's the same description, if someone within 6 feet for 15 or more minutes over a 24-hour period, or if they've had physical contact, or if they've provided care, which wouldn't really necessarily be an issue in a classroom, or if they've shared utensils or drinks or anything like that, or had exposure to their respiratory droplets. So it's that traditional description of a close contact. So if you have a student that meets that definition, but their exposure only occurred in the classroom or on the bus, and both the sick person or the infected person and the close contact were properly masked at all times, and they were never less than 3 feet apart from each other at any time, and all the appropriate mitigation measures were being followed and are being used in your school, in the classroom, or on the bus, depending on the setting, then the student may be allowed to continue to attend school during that quarantine period rather than being placed into a traditional quarantine. So a few things are recommended that you continue to do, though. You should still notify the parent that the child was a close contact. And that is mainly a safety issue, because again, they still were exposed to the virus. They still could become contagious and infectious. They may still be contacted by us or by TraceForce to be followed. They should still limit their social activities outside of school. They may not want to visit people that are at high risk for COVID infection. They should consider having the student tested once or twice during that 10 to 14 days after exposure. So basically, they should still act like a close contact outside of the school setting. The parent should be advised to watch their child closely for symptoms, and should they occur, keep them home, let you or us know right away, and get them tested. You still need to let us know about all the identified close contacts, even if they are allowed to stay in school. You still need to let us know about those people. If you have someone who's had multiple exposures, so if someone was exposed to a contagious individual in the classroom, but they also had gym together, they also sat by each other in lunch, things like that, you'd go with the highest risk exposure that they had. So, if they had multiple different locations where they were exposed, they'd need to be in the traditional quarantine. If you don't really know for sure where all they were exposed, or if they were wearing their mask all the time, things like that, then you should have them in traditional quarantine. If they were ever close together, obviously less than 3 feet, obviously they need to be in traditional quarantine like usual. If you do decide to go with this route, if currently, like let's say you decide tomorrow we're going to do this, if you have students that are already at home in quarantine, they meet these criteria to waive the traditional quarantine, they are never within 3 feet of somebody, it was only in the classroom, they're having no symptoms, they've not tested positive, and they're still within that quarantine time frame, you can choose to let them come back to school if you would like to. Especially if, let's say tomorrow night we're an honors night or something and you want to be able to allow them to come back, you can choose to do that. If for any reason, if kids are staying in the classroom, but now more cases are developing and it looks like there may be an outbreak or something, then at that point, we will likely advise that, okay, these kids need to be in a traditional quarantine at this point. And so those kids that have had quarantine waived should go home to finish out their quarantine. So those are some things that might come up. So as we talk about a traditional quarantine, right now it's 10 to 14 days. 14 days is the safest. It's the gold standard. It's what the CDC recommends. It's what MDHHS recommends. But we are allowing return and exit from quarantine at 10 days with close monitoring from 11 to 14 days if people are not having any symptoms. And we don't recommend anything shorter than 10 days. MDHHS doesn't recommend anything shorter than 10 days, even with negative testing, because it will miss an unacceptably high number of infected individuals. Of course, that's kind of foot and mouth now. We're talking about not even quarantining, but still, if we have situations where we feel people need to be quarantined, coming out early is a higher risk. When the CDC gave that as an option in November, the variants that we have predominant at this time were just not out and around. So, the data back then even is not applicable at this time. So when we talk about traditional quarantine, it's 10 to 14 days. So just to share some information, we went over this last couple of weeks, but just to share it again, I did have some communication with the Network for Public Health Law, and they did share one additional power that the schools have in order to help you, if you have issues or concerns with enforcing quarantine. In the school code, schools have the power to provide for the safety and welfare of students while at school or at school-sponsored activities or en route to any of those things. And so that would apply to enforcing quarantine, according to the public health law specialists. The other one that we've talked about before is the communicable disease rules, which state that a school official that reasonably suspects that a student has a communicable disease, which also would include being exposed to something and needing to be in quarantine, can exclude a student until the health department takes over, and then we have the authority to continue that exclusion. When it comes to quarantine orders, we've never issued those. The state has never issued those, as we've discussed before. I know there's been a lot of confusion about that. But again, you do have the authority to uphold exclusion of students who may be a health risk to other students. So I just wanted to share that. And anyone who's interested, there are some really good resources out there. I added a couple of new ones this week that I found since we've talked before. So in case you ever have a hard time sleeping and you want to read some information about law, there's some more there for you. But I know this has been difficult. So today the governor did have a press conference at 11:30. I missed the first 15 minutes, so I missed basically the good part. And the official press release and new orders have not come out, so I had to go basically based on news stories. So it might not be 100% accurate, but essentially, as of June 1st, all outdoor capacity restrictions are going to be lifted and no masking is required outdoors. Although, if you have people that are not vaccinated or crowded areas, you really should recommend it. So if you have graduations, if you have any events June 1st or later, there should not be any restrictions on those in terms of capacity. And then as of June 1st, any indoor gathering and restaurants can proceed at 50% capacity. Before it was 50% capacity or a maximum capacity of like 25 people or 100 people or different things like that. All of that's should be gone June 1st and just be 50% of the fire marshal maximum capacity. And indoors, those that are not fully vaccinated must continue to wear masks indoors. In the school setting, at least during school hours, teachers, students, and staff should continue to wear masks. And the state MDHHS, I believe, is coming out with a fact sheet at some time, hopefully today or tomorrow. You never know how quickly it will come out, but they were coming up with a fact sheet to kind of address some of these questions. July 1st, supposedly all of the indoor capacity limits are going to end, and the mask mandate is supposed to end completely, and all of the other mitigations are supposed to end. Again, this is just from news stories that I read this. I haven't seen the official, but so the VAC to normal plan has kind of been condensed and changed a bit to not really be dependent on vaccination levels. So a whole separate issue, MIOSHA is still updating their workplace rules, kind of expect it to mirror a lot of this, but again, it's not done yet and they are still working on that. I think it's expected to be done soon. So we'll look at our data. As we know, it's been continuing to improve. So let me just make this a little bigger for you. So for the state as a whole, the cases per million have gone from 253 to 174 per million. And positivity went from 9.8 to 7.7%. We're starting to see some color changes, so that's good. We're not all dark purple anymore. The 6 counties of Central Michigan District Health Department went from 325 down to 208. So we're getting closer to the state average for cases per million. And our percent positivity went from 11.8 to 9.2% positivity. For the 10 counties of District 10, we went from 256 to 152, and percent positivity had a really big drop from 13% to 8%. We've had some days where some of these counties have had some pretty big case counts, so it has fluctuated a little bit, but overall much better. As you recall, some of these counties, even up into Central as well, were in the 400s or 500s several times. Most of the time, it seemed like. For the 3 counties of Mid-Michigan, I don't know if I've seen Clinton this low for eons, but the average went from 307 to 248, and the percent positivity went from 12.5 to 9.2. So getting these percent positivities down to single digits is great. I mean, we were up in the 18 to 20 percentile for so long. So definitely things are continuing to go in the right direction, and we'll hope that that does continue. The data and modeling update for the state, which MDHHS puts together, again, statewide, the positivity when this report was put together was down to 8.5%. And the cases per million were decreasing. We'd seen 5 rates of decreasing positivity. And I think about the same in terms of cases per million. However, Michigan is still one of the worst states in the country. We have the 2nd highest number of cases and the highest case rate in the country. Our inpatient and ICU bed use has been decreasing consistently, but we have the highest inpatient bed utilization for COVID and the highest ICU bed utilization. So, just to know we're not out of the woods. And so as we start loosening up some of these restrictions, we hope that people continue to get vaccinated so we don't backslide. Our deaths have been decreasing as well, but we're still the 3rd highest for the number of deaths, and we have had the highest death rate over the past 7 days. The reported number of school outbreaks did decrease over the past week. High schools have continued to experience the highest number of outbreak, and the highest number of new clusters have been in baseball, softball, and track and field. It's not been terribly high. It's just that those are the most commonly identified. So, but overall still lower. So the percent positivity, again, still going down, but still quite a bit higher than what we were earlier this year, and still as high as we were back in the peak in the fall. I had to pull this from the MyStart map. Again, it wasn't in the state modeling report. So this is the cases, daily cases per million. This is the last 3 months, and the bottom one is for the whole pandemic. You can see here, these huge peaks we had, the 2 surges that we've had. We're just starting to get down to the 150 cases per million. So we're starting to creep back down to where we were in the beginning of the year. So still going in the right direction. So we hope we will continue that way. This is the breakdown of new daily cases per age. It is really starting to get crunched together here. In fact, we have a couple of ties if you really magnify it. Still in the exact same order. So the 10 through 19 age group continues to be the age group with the highest new daily cases per capita for that age group, which is not good, I don't think. And, it goes up from there. And then the 20 and 29 and the 30 to 39 age group are really right on top of each other here. And then the 60 to 69 and 70 to 79 age group are right on top of each other down here. But again, they're all starting to clump together more than they used to be. So the percent of people going to the emergency room for COVID-like illness is 4%. So that means 4 out of 10 people that go into the emergency room are going in because they have symptoms like COVID. It was right around 12% in April. So dramatically decreased, still a lot higher than it used to be, but it's getting better. The hospitalization trends, again, greatly dropping, but still higher. So we still have some work to do. These are our variant counts. As we've talked before, this is really just saying that if you have COVID, it's likely a variant. 76% of our genetic typing of COVID viruses or SARS-CoV-2 virus are the B117 variant. And then another 4% or so are other variants of concern. There have been a few of the Indian variant identified in Michigan, not a huge number, but that has also been found in Michigan. This was an interesting image that one of our epidemiologists had shared. If you look over here, VOC is variant of concern, VOI is variant of interest. So basically the blue squares are the ones that aren't weird. There are more normal variants. And so this was back in January. You can see almost all of the viruses that were being genotyped were the boring normal kind. And you can see now almost all that are being genotyped are the concerning ones. So you can just kind of see the percentage change over the last 4 months. So it's just kind of taken over. So again, at this point, if you get sick, it's likely going to be one of these variants. And the reason they're concerning is because they tend to spread faster and easier. And some of them may be a little less likely to respond to the vaccine, although for the most part, that doesn't seem to be a big concern right now, but that's why they're watching it. To share testing turnaround time, this really continues to be very good and very stable. So testing, wherever you get tested, the places closest to you, many have rapid testing, so you know right away. Others usually get a test back within 1 to 3 days. These are the number of outbreaks that are reported. Again, there's certain where reporting is mandatory, such as schools and nursing homes. So those have big numbers because they're getting reported. And again, high schools tend to be on the higher end. But this week, overall, schools did have a decrease in the total number of outbreaks. For us, in our 19 counties that's on this call right now, we had actually a good decrease in our outbreaks. There was only 1 new outbreak in a high school and only had 2 cases. Last week, and again, this is reporting for the week prior, there were 5 outbreaks that week when we reported previously. So a big decrease. And we now have 16 ongoing outbreaks, whereas the previous week we had 26. And the number of cases involved total has gone down by about 1/3 or so. So, again, good trend to see finally. That has been a concern of mine, so I'm glad to see that. This is just another slide that they had within that report, just to remind us that, those that are not eligible for vaccination at this point, those whose immune system may not respond quite as well to the vaccine, and potentially some of those variant cases are those that are going to be at the highest risk for COVID. So just as an FYI to think about that. And then they had a reminder here that the new CDC mask guidance to be able to not wear a mask if you're fully vaccinated for the CDC guidance, that did not affect the CDC's guidance on masking in K through 12 schools, correction facilities, long-term care facilities, and in public transportation. This looks really busy and crazy, but this was a newer CDC study that looked at just modeling of what COVID may do based on different things. And just to walk you through real quickly, NPI, to remember that term, they used it a lot in the beginning. It's non-pharmaceutical interventions. So things like masking, washing your hand, staying apart from each other. So if we don't vaccinate very well and we don't do any of those things like masking and washing our hands, this dark black line is what we could expect cases to do, hospitalizations and deaths. And this is throughout the US. So again, every state might be a little different. The dotted black line is low vaccinations, but following the non-pharmaceutical interventions. The little dotted blue line is high vaccinations and not following the non-pharmaceutical interventions. And then this best, the best line is high vaccinations and following the non-pharmaceutical interventions. So again, you know, it's still showing that we still have a ways to go to get rid of the pandemic. But to me, I see this, for those that are on the call, as, you know, cross our fingers and let's hope that by next school year, we may be in a promising situation. The one thing I just want to mention, and this is just something to keep in mind, is right now we're in major pandemic, epidemic, you know, do the best you can mode. As we get this back under control, hopefully, if we get to a point where we have very few cases, that's when things like quarantine becomes really important. If you remember the very beginning, or if you remember, if you have a chickenpox case, or if you've ever had to deal with a measles case or anything, if you have one case, you really identify the close contacts and quarantine them really, really strictly, so that you don't have more cases. Right now, it's so widespread, you just kind of give up trying to be strict about it. But just something that we've been talking about in the public health world is that as we get to this really well-controlled world, that's when those measures become much more important. It may be that we never get to that point and it's just always around, but I just wanted to bring that up again, just to plant that seed in your mind. But it's not really anything to worry about at this point. All right, so let me, I'll stop sharing my screen, maybe. And I will go to the chat for questions. If you have any questions, feel free to put them in the chat box. And if you don't have access to your computer at the end, I'll open it up to phone calls and things. Okay. So it looks like our first question is, the optional quarantine guidance states for K through 12 students, could that also apply to staff in a class-only exposure? It really, well, and first of all, I guess I didn't mention this, but you may be seeing something very similar to this coming as guidance from MDHHS in the future. It's just, it likely would not be soon enough to be much help this school year. So we expedited our recommendations. And so there was a lot of discussion about these recommendations between local public health, state experts, very smart people. I would not include staff because adults have been really shown to be much higher risk for spreading. I'm hesitant even to include high school students, but that decision was made to do that just because of trying to help them to not miss so much from their last bit of education here. But with staff, I really wouldn't do that. If you have staff that is not fully vaccinated yet, and they don't have a medical contraindication, I would really encourage them to do that, because obviously they are, they should be eligible, and that would save them from quarantine. But again, it has been shown time and again that a lot of school cases and outbreaks and things are actually started from adults and older students. So no, long story short, no, just the kids. Can vaccinated staff stop wearing masks? No, at this point, it is a CDC recommendation that everyone in the school continue to wear masks. Question 2, first, do you know when MIOSHA will update their orders? I know that they're working on them. I do not know when they will be published or posted or available. Do you know if after masking requirements is listed for vaccinated people, will we still need to do health screenings? I do not know. And I also know that regardless of what you have to do, businesses can do more. So if you feel comfortable continuing to have people mask, continuing to have people do screenings, those are things that, you can continue doing. Just like with this alternative to quarantine, if you feel more comfortable continuing to quarantine everybody, you can do that. What is your suggestion for students wearing masks indoor during our summer school program that runs in the month of June, July, and August? If the concern is that it's hot where you're at, I would encourage, they would still need to wear masks. I would encourage fans. I would encourage lots of water with a straw, because that's easy to slip the straw up under their mask to drink. And if they need to take mask breaks, if they need to step outside and take mask breaks, or even just to spread out in the classroom and take a mask break or something, that's fine. There's a lot of people who work outdoors in the heat with masks and things, and most do fine. The big issue is hydration, making sure they keep hydrated. So again, I would focus on just having nice cold water for them and encouraging them to drink it. Any indication on availability forecast for vaccines for younger students? I heard something about FDA and meetings in June. I have no idea, but my hope is that we might get some younger ages approved June, and if not June, then sometime during the summer. But again, there is nothing specific right now that I know of. Marcus, one of our health officers, said that we were told MIOSHA would be updated Monday. Don't know if they will make that deadline. Yep. And so, as we know, it is never definite when things from the state will make or break a deadline. So hopefully by Monday then for MIOSHA. Is an outdoor graduation ceremony where masks may not be required? What is your recommendation for mask use if a board member is presenting a student with a diploma at a ceremony outdoors regarding the use of masks outdoors? Oh goodness. So first of all, with masks are always safer than no masks. So whenever there's a question of should I or shouldn't I, again, the safest is always wear a mask. If there's a big controversy, complaint from people, you can lean on the law and say, well, you don't have to. But I know we had, my school had a band conference. My kids' school had a band conference this weekend, and the rules had just changed, but they still said everyone still has to wear a mask. And I think that was helpful because then we didn't have anybody complaining. We didn't have anybody bickering or wondering if did that person really have their vaccine or things like that. When you're outside, I know it's different, but I never know how crowded those areas are going to be. If you do have someone who ends up becoming positive, then you have to deal with the repercussions of that. So again, you can always make things required if you feel that that is easier. It's more just what is the minimum you have to do according to orders. And again, masking is always safer. I think that's about all I'm going to say on that because it gets to be complicated. But again, if you're in an environment where people are really angry about masks and it's not worth ruining the whole thing, you can stick with the law. So masks will still be required indoors for students after July 1st. I don't know. Again, right now, the CDC recommendation is that schools continue masking through the end of the school year. I don't know anything past that. What expectation can I give my staff who have been vaccinated but are still required to wear a mask if they most likely can't get sick and most likely can't transmit the virus? To me, they're being a good role model to their students. I would have a hard time not wearing a mask in front of kids that had to wear a mask and explaining why. That would be my biggest issue. The other thing is how would you prove all of your staff is fully vaccinated by the end of the year? And then remember who is all fully, are you going to put a sticker on their name tag? And then that's a violation of their health privacy. And so to me, I think you could probably fall on the logistical nightmare of trying to verify who all is fully vaccinated and then keeping track of it. Because if you see someone without a mask on, can you remember if they are or are not fully vaccinated? So I don't know, if I were in charge, I think those would be the things I would fall on. Is we don't have a method in place right now to track it. And right now we just need to be good role models to our students. I don't know if that's a viable thing for your situation or not, but, and I'm not an educator. I've never been an administrator for a school, but I guess those are just my thoughts. So, and we in healthcare have to continue wearing masks too, regardless of our vaccination status. So it's just it's a part of your employment requirement. So I don't know, to me, it just kind of is what it is. But any other questions? That was the last one that was in the chat. So you can either add more to the chat or go ahead and unmute yourself and ask away. All right. Well, we will send out the slides, and I will have them send out the new criteria for alternatives to quarantine, just to make sure that it gets out to all of our different mailing lists. My thinking is we'll probably continue to hold these meetings for 2 more weeks. If anyone has a problem with that, feels like we need to go longer than 2 weeks, let me know, but that's my current plan. And then, obviously over the summer, we can always add on meetings or things like that. So, all right, well, I'll send the slides, the data, and then that guide to alternatives to quarantine. So have a great rest of your week, guys. Thanks so much.